doing when you're not Maya?
Yes, oo, Karen.
Okay.
Ito yung pinagkakaabalahan ko.
Alright, I'm curious, how did you get involved with the WHO?
No, it's like this kasi, parang 6 months ago when Yolanda hit the country ng Eastern Summer and Leyte, parang, syempre, I just watched together with the whole Philippines, diba, as the events started to unfold. And then I told myself that I wanted to help and I need to help these people. So at first we started collecting more donations to be sent to Tacloban and to Eastern Samar, and then I felt na I can do more. And luckily I met this person who works for WHO through a friend. And
Really?
yes, and she hooked me up with her, and then I told her my concerns and all, and then when the opportunity arose for me to be on field with the team of WHO, I mean, I grabbed it na right away.
Wait, what? Kinikilabutan ako ngayon that it was not WHO who seeked you out because of your celebrity status.
No.
You looked for them because you wanted a way to help.
Yes.
That's amazing.
And nakakatawa kasi
Amazing.
parang yung friend ko happens to know a friend pa who works for WHO, and then yun, nagkausap kami, and then I told her what I wanted to do.
What did you say? What did you want to do?
I told them that I wanted to help. I mean, if there's, I can do, parang in any way that I can, na makatulong, kung anong kailangan nila, eto, I'm willing and available.
That's amazing. You know, you have the heart of a volunteer. It starts there. That first you are willing and available. This is a great story. So, Julie, tell me, when you found out that Jodi Santa Maria wanted to help the WHO, did you even know her? And I'm thinking, you are not the type to be watching Filipino TV.
She's so busy.
All right, go ahead. Foreigners, should I understand?
No, but you know, the moment I said her name to my staff, they were all like, she is fantastic.
Oh, okay.
And it is so wonderful that she's reached out to us
Yeah.
to want to do so much. And it came at exactly the right time because we were launching our Health at the Heart of Healing campaign.
Oh, okay.
And when she reached out, we could feel that heart that you mentioned.
Yeah,
the fact
yeah.
that she wanted to give and support. And it also comes at the right time because right now the people need that kind of support, to know that the heart is there, to know that they're still remembered, and that we're trying very hard to support as we move forward through some difficult times. So it was great, and we've just had the most wonderful time working with you.
All right. Yeah, no, while of course star power in any non-government organization or frankly in any advocacy helps. The problems are quite real. In fact, we have the World Health Organization response infographics, which would state exactly the needs and the problems, the situation in the Yolanda hit areas right now. How many people are affected?
Well, across the whole area, it's about 14 million.
Okay.
But people in the heaviliest affected areas, it's about 4 million.
Okay.
Many of them do not have proper homes right now, and as a result of that, some of their health needs are really quite significant.
Yeah. Okay. All right. The 4 million displaced, in what areas are they?
They're across the whole of the Yolanda affected area.
Okay.
But obviously, Samar and Leyte were the heaviliest affected areas. And as Jodi knows from her visit there,
I was going to say, you went to Hernani,
Hernani and Eastern Samar.
and Eastern Samar.
All 13 villages of Hernani were destroyed.
Yeah.
So,
How did you feel? What was it like for you?
well, syempre, at first, sa TV ko lang nakikita lahat eh. And then, you know what, to see firsthand kung ano yung kailangan pagdaanan na obstacles ng community and kung ano yung mga na-overcome nila is really very humbling, Karen. And, syempre, parang as a former medical biology student and...
You were? Oh my God. Okay.
Biology student and an aspiring physician, parang yung health issues for me is really important. Diba? Parang ensuring that the kids are immunized and syempre yung napapractice ng community yung proper hygiene to prevent the spread of diseases, and you know, yung isupport yung mga mothers and their children sa pag-breastfeed is, you know, some of the issues na very important sa akin.
Well, I have to say you are a perfect fit for the World Health Organization, huh? Even with your history in college. Okay, tell me a story that touched you. Was there any specific mother, a child, or an experience that you remember?
Alam mo, Karen, yung mga stories nila is heartbreaking kung as a mother para sa akin. Because there was one story wherein a mother parang she has two children and she was torn between parang saving the other one and then the other one was being taken away by
the floods.
Ganyan. But then she has no choice but to, be strong for her other kids.
What did she choose? I'm curious. This is a classic movie. I think Frankie Meryl Streep had a movie like this. Sophie's Choice. Yeah.
So
what did she choose?
She had to hang on to that post with her other child, and then she just told her daughter na just hang on dun sa kanyang leg. But then the storm surge was so parang powerful and strong na kinain yung isang bata.
Were there instances that you found yourself crying and emotional in your visits?
Yes, but I had to be strong for them. I mean, hindi pwedeng ako yung unang umiyak sa kanila, hindi ba? Kasi sila yung nandoon sa ganong situation. And we were there to provide psychosocial support to the community. So everyone has to be strong. And, just sympathize and make them feel that they're not alone with this ordeal.
Very interesting. So you provide, Julie, psychosocial support other than what else?
Yes.
When you visit the communities?
That's right. I mean, we support the government to provide the whole range of health and well-being that's required by the communities. And putting health right at that heart of healing is so important. People need to be physically well.
I agree.
So
they need to be
the,
strong
exactly.
to actually recover.
Yes.
Yeah. If you are sick, you cannot bounce back.
Absolutely.
You cannot rebuild your home. You cannot function well.
Care for your children, care for those that have lost, and reach out. And we see so much resilience in the Filipinos, but it has been such a big blow to the communities, such an amount of loss that's happened. And so what we're seeing now at about 6 months is that people are physically starting to get their lives back together, but that sense of loss that you've described is really quite powerful.
All right, what illness pervades in the communities you visited? In other words, what was the worst you had to treat, or what was rampant?
Yeah. Well, initially there were obviously a lot of injuries from the typhoon itself, but very quickly after that, there are pre-existing medical diseases. So people with diabetes, with TB, all of them needed to get back on
TB. That's very contagious, if the TB is active.
Correct.
So do you have to treat people with TB?
Yes, and try and find all of those patients who were on treatment before the typhoon and quickly get them their medication, get them the support and get them back on treatment.
All right, what about tetanus?
Yeah.
You must have treated a lot, no, for tetanus?
Correct. I mean, this is an important thing that all children should be vaccinated against, but obviously some children have missed that. And as adults, they're then at risk of getting tetanus.
Yeah.
And so that was an issue in the first few weeks. But some of the things that Jodi's been doing with the communities, encouraging mums to take their babies, take their children, get vaccinated. Incredible.
So when you were encouraging the mothers, Jodi, was it easier than you thought or harder than you thought? Alam mo naman ang Pilipino, ayaw pumunta sa yung paulit-ulit na vaccination, medyo it takes effort.
True, but we had to explain to them the importance and the significance of having their children vaccinated. It's parang a way of preventing kasi and acquiring, certain type of diseases.
Yeah.
So when I would explain to them, I told them parang, mommy, parang mahirap na yun ang gamot, ganyan. Sa pagpapagaling, siguro mas maganda kung iwasan na natin. Kumbaga parang yung information na binibigay ko sa kanila is prevention is better than cure.
No?
So, mas preventive ang
You're
approach.
such a doctor. Yes, I swear. Yes. Go on. Yeah.
So, there, and they listened naman, and then I told them that I promise to be back, and I'm gonna check on you guys, and you have to promise me to have your children immunized. And then they said yes. And then I told them that I'm hanging on to their word.
Lagi initin yung
that
ulam.
they adore your character. I'm curious. Because clearly Be Careful With My Heart is a worldwide hit in the Filipino community. In the Philippines, it's been #1. In fact, right now, your character, Maya, they have to stretch. And I mean, you now gave birth to twins. I mean, you're past the pretty woman stage of marrying the prince. So baka hanggang lola ka, it's still running. It is #1. And does it make it more effective, you think, as an advocate? That, you know, they're crazy over you, they're starstruck, they're listening. Does it make your job easier?
Yes, in a way, oo. Kasi mas nakikinig sila.
Oo.
And whenever I tell them something, mas madali nilang na-absorb.
Yeah.
And siguro bukod sa lahat ng yun, mas thankful sila or appreciate nila yung presence na may taong nag-care for them, that they are not forgotten.
Yeah. Okay. All right. Not only that, the WHO response infographics, you've done a lot already there. You've also assessed how many public health facilities are needing assistance.
Yes, well, there are nearly 600 public